Hi everybody, and welcome back to my vlog, A Dose of Reason. I'm Dr. Shira Doron, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. Every week, I'll provide answers to your questions about the COVID-19 pandemic and offer my takes on the latest news and science to help you make the best health and safety decisions for you and your family. You can send me your questions about the pandemic, this year's flu season, or anything related to infectious diseases to adoseofreason@tuftsmedicalcenter.org. Please include your first name and hometown with your question. I'll pick a few questions each week to discuss in the vlog. Here are two questions that we received about a similar theme, boosters. Arnie from Carver asks, I received the Pfizer COVID-19 vaccine in December and January. I had a breakthrough COVID infection this past August and had a monoclonal antibody infusion in early September. My question is, when can I safely get the Pfizer booster shot? Do I have to wait 90 days after the infusion? And then Jamie from Medford asked, my wedding is coming up soon and I plan on going out of the country for my honeymoon shortly after. I am fully vaccinated against COVID-19 and to my knowledge, I haven't been infected. The breakthrough cases are concerning to me as I don't want to miss my wedding day or test positive right before getting on the plane for my honeymoon. I'm now eligible for the Pfizer booster shot, but if I didn't have these events coming up, I'm not sure I'd really want or need the booster. Any advice? Let's take these two booster questions together. Both of these individuals received Pfizer vaccine, and at this very moment, only Pfizer recipients are eligible for boosters. We'll have more information about Moderna and J&J boosters next week after the FDA and CDC finalize their recommendations. Now remember, there are categories of people who should receive boosters and categories of people who may receive boosters, and then still a lot of people who are not recommended to receive them, and they're listed on your screen. If you don't want one, you don't need one, because the Pfizer vaccine is still holding up really well against severe disease, hospitalization, and death, and those are what matters most. That being said, if you're eligible, Jamie, and you have a big event like your wedding coming up, I can tell you that the data out of Israel suggests that you will gain quite a bit of protection against asymptomatic and mild infection from the booster, and it is safe. Now, Arnie, you have a different situation. You should definitely not get a booster within 90 days of getting a monoclonal antibody infusion because it can interfere with your immune response. And even then, it's somewhat questionable whether you need one because your infection may have provided just that boost in immunity that you need for better protection. We'll have to wait for more studies on that one. Our next question comes from Charles from Boston. At this point, where COVID-19 has been so prevalent all over the world, can you explain the rationale for why testing of asymptomatic, fully vaccinated people still makes sense anymore? Asymptomatic people are not tested for flu. Why are we still doing this for COVID? Thanks for the great question, Charles. I'm not a fan of routine asymptomatic screening testing for COVID in fully vaccinated individuals, and for a few reasons. First, routine screening, like what's done by some employers and schools, is typically associated with pretty small rates of positivity. When you do that in a vaccinated population, the rate is even lower since vaccination decreases infection at least 5-fold. Now, since no test is perfect, when the prevalence of infection gets that low, what happens is that more of your positives are false positives than true positives. And there are harms that can result from false positive COVID tests. That's why the CDC recommends exempting vaccinated people from routine screening programs. That being said, when would I suggest vaccinated people be tested? Definitely anytime they have even mild symptoms. In the absence of symptoms, you could consider testing if you're going to spend time with someone vulnerable, such as elderly or immunocompromised friends or relatives, since even vaccinated, you could still have asymptomatic infection, though it's a lot less likely than if you're unvaccinated. You should also consider being tested 3 to 5 days after a known close contact with someone who had COVID. It's not a rule here in Massachusetts, but it's recommended by the CDC. Our last question comes from Jonathan from Natick. I saw General Colin Powell died from complications of COVID-19 earlier this week, even though he was fully vaccinated. I thought the vaccine was supposed to protect you. Is there a chance it may not work? Hi, Jonathan. I was sorry to hear about Secretary Powell's death from COVID. It's a good reminder of a few important things. 1, not everyone responds well to vaccination. Powell had a blood cancer that impaired his ability to mount an immune response to the vaccine. 2, and for that reason, it's critical to maintain a bubble consisting only of vaccinated people around anyone who's that vulnerable. His older age also probably played a role. And 3, just because a vaccine is not 100% effective doesn't mean it's 0% effective. It's not an all or nothing thing. You're more than 10 times more likely to die of COVID-19 if you're unvaccinated than if you're vaccinated. So if you haven't been vaccinated yet, get vaccinated. That's all the time we have for this week. Please keep your excellent questions coming to adoseofreason@tuftsmedicalcenter.org. I look forward to dishing out a dose of reason to you again next week.